Welcome back. Lung cancer is the leading cause of cancer death here in the United States, killing more than 127,000 Americans each year. Regular screenings can help with early detection and possibly make treatment even easier. Joining me today for National Lung Cancer Screening Day is Joan Burnham, a thoracic oncology nurse navigator with Houston Methodist Sugar Land Hospital. Joan, thank you so much for joining us this morning. It is so important for us to get the word out. You hear about breast cancer screenings, you hear about all these other screenings, but lung cancer, it's usually not at the forefront. What goes into a screening?
So a screening is a simple low-dose computerized tomography, which is a CT scan. It's about 15 minutes. There's no contrast involved. You come in, you lay down on the table, we ask you to hold your breath. We take the pictures, we do that 3 times where you hold your breath, and you're done. So in 15 minutes, you're out with your lung cancer screening completed.
Who should do these screenings? It's not just former smokers or current smokers, correct?
The lung cancer screening is focused to people who have smoked previously. Unfortunately, it is not covered for people who are non-smokers or exposed to secondhand smoke. So if you have a 20-pack year smoking history, that's 1 pack of cigarettes a day for 20 years, or 2 packs a day for 10 years, you are eligible for lung cancer screening. The other qualifications are between the ages of 50 and 80, and we used to have where we would impose a 15-year quit date where we would not do screenings anymore. But recent information has come out that it is more effective to continue those screenings even after age 80 because, while your risk of lung cancer drops when you quit smoking, as you age, that risk goes up more than someone who never smoked before. So we continue lung cancer screening now regardless of when you quit.
Why are these screenings so important, and why is it so important for us to get the word out?
So lung cancer screenings, we ask for you to be asymptomatic, which means no symptoms. By the time you have symptoms, your disease is fairly advanced. And so it's really important for us to catch those cancers early. Not only does it prolong your life, I have more people living longer, even with advanced stage cancers, but the cure is potentially in reach if we can diagnose it early, and your treatment is limited so that you're not having to do multiple radiation, surgery, chemotherapy, but rather just a simple one focused treatment where either radiation or surgery for early diagnosis lung cancer.
We were talking about it off camera. How do you encourage people to quit smoking, and what is the role that smoking plays with lung cancer?
So smoking, we know burning tobacco leaf has over 7,000 carcinogens in it. Vaping is a little bit easier because it's not as much, but stopping smoking, there is a benefit regardless of how old you are. Not only does it minimize your risk of cancer because it can also cause bladder cancer and other cancers, but it also decreases your risk of breathing issues as you age, as well as heart issues. So, you know, we have our lung model here, and one side is the smoker's lung, and inside there is a tumor, and the other side is the healthy lung. And this lung is going to be much more expanded, so poor oxygen exchange, but also it blocks off a large portion of that lung, so the oxygen absorption is much more compromised if you have cancer.
So very important, and thank you for coming to share that information with us. I really hope a lot of people can become aware, especially if they've been former smokers or current smokers as well. Joan Burnham with Methodist Hospital, thank you so much for joining us this morning. And you can find all this information and a replay of this segment online at click2houston.com. After the show, it'll be posted right there under the community section of the website. Stay with us. We'll be right back after the break.